If any of you are having problems with your nails, or maybe someone close to you has brittle, fragile, or weak nails, then this video is for you. And if you find it helpful, be sure to let me know in the comments. However, it turns out that as many as 30% of people have this problem of weakened nails. And the reasons are very different, both those that are so-called mechanical damage, such as external factors, as well as internal ones, when something starts happening in our body that causes the nail plate to weaken. And that's exactly what we're going to talk about today. I'm going to present to you as many as 19 reasons why this problem may occur, and thanks to that, you'll know how to fix it. But what does it mean to have weak nails? Well, first of all, it means that they might grow very slowly, they might simply crumble and break. Different kinds of ridges can appear on them, for example, horizontal ones, or they can peel off in layers, simply splitting. And problems can occur both on the hands and on the feet. On the feet, we can even notice it more often and more quickly because if the nails are already starting to get weak, we wear shoes, and those shoes put extra pressure on them, especially if they're a bit too short or a bit too narrow. That simply makes us notice these changes more quickly. First, let's take a look at these internal problems, like what's happening in our body and why such symptoms might appear on our nails. And the first thing is, of course, deficiencies. Deficiencies of vitamins and minerals, which can occur for various reasons. Whether it's because we have a poor diet and aren't getting enough of them, or because, for example, there are health problems in the digestive system and they simply aren't absorbed. We'll talk about health problems in a moment. First, let's focus on specific minerals or vitamins that we might be lacking. I would put biotin, vitamin B7 at the top of the list. Our nails are made of keratin, and it's B7 that affects keratin production. If there's a lack of B7, these kinds of problems will occur. Another thing, other B vitamins that are worth paying attention to are B12 and folic acid. Deficiencies in these can also cause problems with your nails, your skin, and your hair. One more substance, this time a mineral, is zinc. Many people know that zinc is essential for the skin, but we forget that it also plays an extremely important role in how strong our nails will be. Calcium, another element that is essential for making nails hard, and also for them to be strong and not brittle. The amount of vitamin A in our body also has an impact, so we do need a few of these elements. And that's not all. For example, silicone is absolutely underrated. It makes your nails hard, but at the same time quite flexible, and they don't crumble. Iron is just as important. With iron deficiency, with anemia, we can very often notice problems first on the nails. And if someone suspects they have an iron deficiency, it's worth getting tested. The level of iron and ferritin in the blood. Additionally, let's remember that, for example, omega-3 helps prevent inflammation and helps prevent micro-injuries and minor damage. That's why a deficiency of omega-3 can also lead to problems with your nails. Collagen can also support the condition of your nails. Just remember to use it together with vitamin C. Vitamin C will help your body build its own collagen fibers. But in addition, we need it so that iron is also well absorbed. So it will play a very important role here. Apart from these vitamin and mineral deficiencies, let's now look at health problems that can manifest themselves on our nails. And for example, hormonal disorders. During menopause or pregnancy, we may notice that changes appear on our nails. But also with thyroid problems. And here, regardless of whether it's hypothyroidism or hypothyroidism, nails can become very brittle. Here I would say that when doing tests, we should pay attention not only to TSH, because TSH can still be within the normal range, but the body may already be signaling that something is starting to happen with the thyroid. That's why when we do tests, we do the whole panel. In addition to TSH, we check antibodies, anti-TPO, and we also test T4 and T3. Because when there's a problem with the conversion of T4 to T3, symptoms can already start to appear on the nails, which signal to us that we need to take care of the thyroid. And it often also suffers from a deficiency of various nutrients. Maybe a few different ones, although it's the same group of B vitamins. There will also be zinc, there will also be iron, and then there's also iodine and selenium. Selenium, among other things, is very important for nails precisely because it affects our hormones. Then there's diabetes. In general, not just diabetes. I describe it more as diseases that cause circulation problems. This can include diabetes because here the blood vessels will be damaged. Raynaud's disease. When the vessels are damaged, oxygenation suffers. Simply, the nail plate is undernourished and the nails become brittle. And at the beginning, we mentioned that various ailments are related to the fact that nutrients are not being absorbed. These are mainly problems with the digestive system, starting with the stomach. Low stomach acid. In that case, iron will not be absorbed. A severely imbalanced gut flora. In that case, other minerals and vitamins won't be absorbed. We should focus on the digestive system and work to regenerate the mucous membrane. Let's restore the gut flora. And if there are ulcers, Crohn's disease, diarrhea, or constipation, unfortunately, the nails will also suffer, just like the skin and hair when it comes to the skin. Serious skin problems like psoriasis, eczema, fungal infections, they can also affect our nails. So it's sometimes worth consulting a dermatologist to check for any changes. For example, nail fungus. Nail fungus is sometimes very noticeable. When it's advanced, you can see these very unattractive changes. But the initial symptoms of a fungal infection can simply look like weak, flaky, brittle nails. So it's worth asking a specialist for a consultation. And although I already talked about hormonal disorders, I think it's also worth mentioning excess stress separately. Excess stress. Among other things, an excess of the stress hormone. It causes our body not to regenerate properly as well. And this kind of constant stress, as well as sleep disorders, causes nails to become weak. But these are just the internal factors. There are also external factors like mechanical damage. These can be various types of injuries. Impacts to the feet. So we should especially pay attention to shoes, making sure they're not too tight or uncomfortable. But also using overly aggressive cleaning agents at home. Some people still use very strong chemicals. And on top of that, they don't wear gloves. There are people who work in such harmful conditions. And in those cases, their nails are also damaged by these detergents. Nails can also be damaged by constantly being in water. People who work with water as well. Well, I don't know, they wash pots or are constantly cleaning, also without protecting their hands. This causes the nails to become very dry. And that's why later on, not only do they peel, cracks appear on them. And that's also an entry point for infections. For example, it's easier to get a nail fungus in this situation. And improper care. When someone files their nails incorrectly, it's not recommended to file in different directions. Always file in one direction. You shouldn't use metal nail files. It's better to use glass or paper ones. Always use sharp scissors. That's something to pay attention to. And of course, if someone goes for a manicure, we should pay attention to that as well. How is the manicure done? Does it damage the nail plate? Look, there are so many factors. If we analyze and review what could be the cause for us, it will be easier for us to fix the damage. First of all, make sure there are no mechanical injuries, because that's the simplest thing. Protect your hands, take good care of them, and look after your hands. But also, if there are deficiencies, because, for example, we don't have any serious digestive system diseases, or with diabetes, for example, then it's worth considering what's wrong with our diet and possibly supplementing the minerals and vitamins I talked about today. And that will already be a huge help and a big tip for you. In the next recording, I will tell you step by step what kind of diet, what supplements, and what home treatments. They can speed up the regeneration process if such changes appear. The only thing I would still like to add today is that if you see that you're trying different things, but these changes still don't go away, it's worth going to a specialist. And also pay attention. If you notice dark discolorations on your nails, because dark discolorations can be very dangerous, even melanoma can develop under the nail plate. That's why anything that worries you, you should immediately consult. Let a specialist take a look first and give their diagnosis. Then you can take simple steps at home to help yourself. Thank you very much for your attention and see you in future videos. This was Natalia Samarek with you.